The remaining bones of the axial skeleton are not nearly as complex as the bones of the skull. In this presentation, we will examine the hyoid bone, vertebrae, sternum, and the ribs. The hyoid bone is a U-shaped bone that is not part of the skull, but is closely associated to the mandible and temporal bones. It is located in the neck between the mandible and larynx. The hyoid is unique in that it is the only bone of the body that does not articulate directly with any other bone. It is suspended by ligaments and muscles from the styloid processes of the temporal bones. It serves as a movable base for the tongue and an attachment point for neck muscles that raise and lower the larynx for swallowing and breathing. To test this out, put your fingers on your Adam's or Eve's apple, as the case may be, and swallow. What happens to the larynx when you do this? The hyoid bone is connected to the larynx via the thyrohyoid ligament or membrane. When you swallow, muscles attaching to the cornua or horns of the hyoid from the skull above contract, raising it superiorly in your throat, thereby blocking off the passageway to the lungs, namely the larynx and trachea. The vertebral column is the axial support of the body consisting of 26 vertebrae and extending from the skull, which it supports, to the pelvis, where it transmits the weight of the body to the lower limbs. Being made up of 26 stacked vertebrae, the vertebral column not only protects the spinal cord, but also allows the body to bend anteriorly and posteriorly, laterally, and to rotate the trunk. The vertebrae are connected to each other by joints that are reinforced by ligaments and small, deep back muscles. The vertebrae serve as attachment sites for muscles and ribs. When viewing the vertebral column from the side, four S-shaped curves are apparent. The spinal curvatures in the thoracic and sacral regions are referred to as primary curvatures because they are present when we are born. Later, the secondary curvatures develop. The curves are an adaptation for walking upright. They help to reduce stress, increase the strength of the vertebral column, maintain balance, and absorb shock when walking. Even with the curves and other reinforcing materials, there are many problems resulting from back injuries. The secondary curves develop when the baby reaches certain developmental landmarks. The cervical curvature appears when a baby begins to raise its head, and the lumbar curvature develops when the baby begins to walk. There are several types of abnormal curvatures to the spine. These abnormalities may be congenital, present from birth, or may result from disease, poor posture, or unequal muscle pull on the spine. An abnormal lateral bend to the spinal column is called scoliosis. This is easy to observe because one shoulder and coxal bone will be higher than the other. Kyphosis is an exaggerated thoracic curvature known as hunchback or round shoulder. It occurs in both males and females, but it is particularly common in females with osteoporosis. Lordosis, also known as swayback, results from an exaggeration of the lumbar curve. As you can tell, all of these abnormal curvatures will impact the gait and can cause back, hip, knee, ankle, and foot pain. Before birth, the spine consists of 33 separate vertebrae, one from each of the body segments or somites. 9 of the 33 fuse to form two composite bones, the sacrum and the coccyx. Of the 24 single bones, there are 7 cervical neck, 12 thoracic chest, and 5 lumbar equal loin vertebrae. You can remember the number by thinking of traditional meal times: breakfast at 7 a.m., lunch at 12 noon, and dinner at 5 p.m. 5 vertebrae fuse to form the sacrum, which means holy sacred bone, and 4 tail vertebrae fuse into 1 or 2 bones called the coccyx, which means a bill of a cuckoo. The vertebrae are irregular bones. All vertebrae have a similar structural makeup with variations of the common theme. The features they have in common are the 1. The body or centrum is the weight-bearing part of the vertebra. The body is disc-like and faces anteriorly in the vertebral column. The pitted surface of the body is the result of numerous nutrient foramina and is the site of the attachment of the intervertebral discs that cushion the vertebrae. 2. The vertebral arch is formed from the joining of all posterior extension, the laminae and pedicles, from the vertebral body. 3. The vertebral foramen is the canal through which the spinal cord passes. 4. The transverse processes are two lateral projections from the vertebral arch. 5. The spinous process is a single projection arising from the posterior aspect of the vertebral arch. 6. The superior and inferior articular processes are paired projections lateral to the vertebral foramen, allowing a vertebra to form joints with adjacent vertebrae. Examine the vertebral column of your skeleton model. Notice that the vertebrae become larger and the bodies get heavier from superior to inferior, and that the vertebral foramina are largest in the cervical region to accommodate the size differences of the spinal cord. The posterior view in this diagram shows how adjacent vertebrae articulate with the vertebra above and below via smooth facets located on the superior and inferior articular processes. Also apparent in this picture are the intervertebral discs that cushion the vertebral bodies. A pinched nerve is a common clinical complaint. Recall that the pedicles are notched inferiorly and superiorly. When the vertebrae are aligned properly, the notches of adjacent vertebrae form an opening called the intervertebral foramen. Spinal nerves leaving the spinal cord on their way to the shoulders, trunk, and legs pass through the intervertebral foramina. Pinched nerves result when vertebrae are misaligned. An even more serious situation arises when an intervertebral disc herniates. Each intervertebral disc is made up of a central, jelly-like structure called the nucleus pulposus. During early embryological development, a rod-like notochord helped to maintain the long axis of the body. As development continues, the vertebrae form around the notochord, which is retained as a shock absorber in the center of the intervertebral discs. A tough ring of fibrous connective tissue called the annulus fibrosus surrounds it. Together, the annulus fibrosus and nucleus pulposus make up the intervertebral discs. Certain types of injuries result in the nucleus pulposus squirting outward, which results in pain as well as misalignment of the vertebra. Notice in the picture on the right above that not only is the segmental spinal nerve pinched, but that the entire spinal cord is rotated within the vertebral canal. A condition known as spina bifida results if the laminae fail to unite at the midline during fetal development. When the baby is born, the spinal cord and its coverings protrude into a fluid-filled swelling instead of being protected within the vertebral canal. Spina bifida can result in paralysis, loss of bladder control, loss of reflexes, and even death. In addition to the common features shared by vertebrae, there are variations in structure in different regions of the vertebral column. For example, the cervical vertebrae C1, C7 form the neck region of the spine. The first two vertebrae, the atlas and the axis, are different from the other typical cervical vertebrae because they perform functions in head movements that the other cervical vertebrae do not. We will discuss them separately. All cervical vertebrae have a foramen in their transverse processes. This is for the passage of the vertebral artery and vein. The vertebral artery, along with the internal carotid artery, supplies the brain with blood. C3, C6 have bifid or forked spinous processes, and C7 is known as the vertebra prominens because it has a large, non-bifid spinous process. To locate C7 on yourself, put your fingers on the base of the neck and turn your head from side to side. C7 will move, but the first thoracic vertebra will not. The first cervical vertebra, C1, is given a special name. It is called the atlas. The atlas supports the head and is named after Atlas of Roman mythology. Because of Atlas's misbehavior, he had to bear the weight of the world on his shoulders. For us, that weight is the 10-pound head. The atlas is different from other cervical vertebrae in that it lacks a body and spinous process. In top left picture shows a superior view of the atlas. The superior articular facets are concave and articulate with the occipital condyles of the skull forming the atlantic-occipital pivot joint, which allows us to rock our heads back and forth, as in the yes movement. The inferior articular facet forms a joint with the second cervical vertebra, C2, also known as the axis. This is visible in the picture on the bottom right. The axis has a body and a peg-like process called the dens or odontoid, which means tooth process. The dens projects up through the anterior portion of the vertebral foramen and forms a pivot on which the atlas and head rotate. The atlantoaxial joint is a pivot joint that permits the no movement. In severe whiplash cases, the dens can be thrust into the foramen magnum and stab the medulla oblongata of the brainstem. This is frequently fatal because the medulla oblongata contains brain centers for many visceral functions like breathing, heartbeat, peristalsis, vomiting, etc. There are 12 thoracic vertebrae. They are larger than the cervical vertebrae and have facets on their transverse processes and body for articulating with the tubercles and heads of the ribs. Only T11 and T12 lack facets on their transverse processes because the last two ribs have no tubercles. The thoracic vertebrae have long, inferiorly directed spinous processes. There are 5 lumbar vertebrae. They are the largest and strongest of all the vertebrae because they support most of the weight of the body. The lumbar vertebrae have large bodies, but short and thick processes. The superior articular processes are directed medially instead of superiorly. The inferior articular processes are directed laterally instead of inferiorly, and the spinous process is short, thick, and points posteriorly. Very large back muscles attach to the spinous processes. An easy way to tell the difference between thoracic and lumbar vertebrae is that thoracic vertebrae in profile look like the head of a giraffe, and lumbar vertebrae look like the head of a moose. The sacrum is formed by the fusion of S1-S5. Interestingly, fusion begins at age 16 to 18 years and isn't complete until the mid-20s. The sacrum supports the pelvic girdle. It forms the posterior portion of the pelvic cavity. Its anterior surface has transverse lines left from the fusion of the sacral bodies, and there are 4 pairs of sacral foramina that transmit the spinal nerves and blood vessels. There are many sacral landmarks or bony features to the sacrum which will be described in the following slide. The sacral ala are the wing-like processes formed by the fusion of the transverse processes of S1. The sacral promontory is used as a landmark for measuring the pelvis. Important in obstetrics. The median sacral crest is found on the posterior surface and represents the fused spinous processes of the 5 sacral vertebrae. The sacral canal is a continuation of the vertebra canal, and the sacral hiatus is found inferiorly where the laminae of the 4th and 5th sacral vertebrae fail to meet. The auricular surface articulates with the ilium of the hip bone. Auricle is another word for ear, and so the auricular surface is ear-like in shape. There are differences in the shape of the sacrum between men and women. The sacrum of females is shorter, wider and more curved between S2 and S5, and the sacrum of males is longer and narrower. The coccyx or tailbone is formed from the fusion of 3 to 5 tiny, irregularly shaped vertebrae. In humans, the coccyx is the remnant of the tail that other vertebrate animals have. As with the sacrum, there are gender differences in the morphology of the coccyx. The female coccyx points inferiorly and the male coccyx points anteriorly. The gender differences in both the sacrum and coccyx is related to childbirth by females. The sternum, ribs, and thoracic vertebrae make up the bony thorax. The bony thorax is called the thoracic cage because it forms a protective cone-shaped cage of bone surrounding the heart, major blood vessels, and the lungs. The sternum or breastbone is a flat bone approximately 15 centimeters long located in the midline of the thorax, just anterior to the heart. It is made up of three portions: the Manubrium, body, and xiphoid process. The junction between the Manubrium and body form a superficial landmark called the sternal angle, which is used to find the location of the second rib. The major bony landmarks of the sternum include the suprasternal or jugular notch. It is located on the superior surface of the Manubrium. The clavicular notches are located lateral to the suprasternal notch and are the sites of attachment of the pectoral girdle to the sternum. The xiphoid process is a small, pointed structure. No ribs are attached to the xiphoid process in any way, but it is an attachment site for some abdominal muscles. There are 12 pairs of ribs that collectively compass the sides of the thoracic cavity. Together with the sternum, the ribs help to protect the viscera of the thorax. The ribs are divided into two major categories. The true ribs, also known as vertebrosternal ribs, are pairs 1 to 7. The true ribs articulate with the sternum via a strip of hyaline cartilage called the costal cartilage. The false ribs are pairs 8, 9, and 10, which attach to each other and the cartilage of the seventh pair of ribs. For this reason, ribs 8 to 10 are called vertebrochondral ribs. Rib pairs 11 and 12 are called floating ribs because their anterior ends don't attach to the sternum. Ribs 1 and 2 are atypical in that they are shorter and shaped differently than the other more typical ribs 3 to 9. In fact, rib 1 looks like a seahorse and has a very short chondral cartilage, which in older people calcifies. The typical ribs 3 to 9 articulate with two vertebrae. The facet on the head articulates with the facet on the bodies of adjacent thoracic vertebrae. The neck is the constricted part of the bone with a tubercle that articulates with the articular facet on the transverse process of an inferior vertebra. The body or shaft is the main part of the rib. The costal angle is an abrupt bend in the body of the rib, and the costal groove is groove located on the inner and inferior surface of the rib. It transmits and protects blood vessels and nerves, which are wrapped together with connective tissue forming neurovascular bundles going to and from the trunk muscles, glands, and skin. Through their attachments with the transverse costal facet and demifacet of the vertebral body, the ribs are able to swivel when we breathe in and out. This allows the thorax to get larger upon inhalation and smaller upon exhalation. The movement is somewhat like picking up the handle on a bucket to carry it inhalation and letting go of it exhalation. What do you think is the reason for attaching the ribs to the sternum via hyaline cartilage? Would ribs made of solid bone be better able to protect the heart and lungs?